Okay, thank you and good afternoon, everybody, on this rainy afternoon. The region continues to make some good progress, and as we gradually begin to reopen the economy. Overall, the trends are still heading in the right direction in admissions and hospitalizations. We're going to continue to see some day-to-day fluctuation with increases and decreases, but we want to keep our focus on those trend lines. So before we look at the data, the way that we have made progress in this is from our ongoing commitment to all of those evidence-based practices, such as washing hands and social distancing and keeping surfaces clean. And we can't forget that those are the things that brought that transmission rate low. And those are the things that we need to continue to do even as we begin to relax some of the shelter-in-place rules. Those are the things that are going to keep everybody safe. And we simply just can't ignore all of those steps that we've taken up until now to prevent the spread of the virus. And it's really, really important that we continue to do all of those really important things. You know, what we don't want to happen is for us to have that second wave where we would have more cases, more hospitalizations, and be ending up going backwards. And so our message for today is to keep doing what we're doing even as we begin to relax some of those rules. So let me go ahead and start with our chart again. This is showing our hospital admissions, and it continues to show progress. The trend in daily hospitalizations since April has continued to come down. The rolling average has seen a steady decline since early April. Now remember, the data on this chart is lagged for about 2 days. That's because these are confirmed positive COVID patients. And so you'll see on Monday we admitted 32 new patients, which is an uptick from our recent numbers, but our rolling average held steady at around 27 and remains low as since we first started tracking this data. And so while we're always concerned about any uptick in cases, again, we really want to focus on the trends. And so we'll keep an eye on this data as we go forward, and we'd really like to see that decline continue, but we'll continue to look at this data. Next is our hospitalization rolling average. And so these numbers continue to show progress. This is our daily census of COVID positive and suspected COVID patients, as well as the rolling average. And so today's rolling average is around 526, and it's still on the downward trend. This number continues to trend down, and it's lower than it's been since we really started tracking this data, which is good. Overall hospital census also came down from yesterday, which is always good as well. And we want to see this moving average continue to drop going forward. So let's get to our numbers now. We have 513 patients hospitalized with either confirmed COVID or suspected COVID, or patients under investigation. And that's down from 531 yesterday. And we have 125 COVID or suspected COVID patients in our intensive care units, which is down from 137 yesterday. And we have 93 confirmed COVID or suspected COVID patients on ventilators, which is down slightly from 94 yesterday. And again, our good news slide, we discharged 34 COVID patients yesterday, bringing our cumulative total to 1,745. And so again, thank you to all of those healthcare workers who have made these patients get better and been able to go home. So thank you for all of your hard work with these patients. A couple of other slides I wanted to share with you. Every once in a while I will share our modeling slides, and so that's what this slide is. So every Friday the task force takes a look at the models and then compares that to our actuals. And so this is our latest slide from Friday of last week, where we compared how we were performing against our model. And so as you can see, we've done fairly well, and we're running right along where we thought we would be compared to the model, which is good. The second thing I would point out there is that the downward slope, we continue to follow the downward slope. And so there's another yellow dotted line there that shows a slow decline, which is what we were afraid of if the rate of transmission wasn't coming down as far as we wanted it to. But we believe that rate of transmission has been kept sufficiently low, which is why we're starting to follow the model line, with those numbers decreasing as we suspected they would. And then the next one is our ICU admissions data as well. And as you can see, early on in the outbreak, this was a concern. But as time went on and we were able to suppress the curve, as well as I would say some improvement in techniques in treating COVID patients as well, this number has come down quite significantly and is now trending below what our projected numbers were. And so again, this is really good news. It gives us confidence that what we're seeing is actually true, and that what we predict is going to go into the future will also, likely be true as well. Now, all of that depends, though, on the transmission rate, and so we have to do all those things that I said at the beginning of my statement, which is washing hands, social distancing, masks out in public, all of those things to keep that transmission rate low. And as I've said many times before, we'll continue to follow this data going forward and make sure that we're going in the right direction. And so just in closing, we continue to make good progress. We are going to have those upticks up and down, but we follow the trends. And so we're following along the data, and we think we're headed in the right direction. And we'll keep a really close eye on the data and advise people of what we're thinking we're seeing as we begin to relax some of these policies. So with that, I'm going to conclude and go to the questions from the media.
Are healthcare systems within the task force operating under crisis standards of care?
No. So I've spoken with all of the leaders from the different hospitals, and they feel very comfortable with where we are right now. And so I'll use a couple of reasons for that. So our ICU status is doing very well. As you saw in our graphs, the ICU numbers have been coming down and are following our model pretty well. The teams are not as stressed as they were earlier in the outbreak. The number of ventilators that are being occupied by COVID patients has come down considerably as well. The PPE status is still, we're still gaining ground on PPE, so we're not completely out of the woods with that, but we're feeling much more comfortable. And the other reason I would say that the health systems are feeling better about this is we're now starting to get back into some of the other business that we had sort of pushed off to the side or slowed down during the pandemic, and that includes some of our surgeries, which we need to start doing or getting ramped back up as well. Not elective surgeries, but delayed surgeries from 6-7 weeks ago. And so we do feel comfortable that we're in a good spot right now.
Dr. Garza, a number of questions today about testing. Do you think people should be getting these antibody tests that are more widely available on the market?
So as you've heard me say a couple of times, antibody testing is you have to be careful which antibody testing you're doing. So early on, the FDA had allowed companies under the emergency use authorization to promote their antibody testing without doing a lot of validation studies. And so that led to a lot of tests out on the market that really did not perform well, didn't perform well enough to be used for any sort of judgment on whether people had immunity or not. So the FDA has tightened those up a bit. There have been validation studies, particularly on the ones that are run in the hospitals, so we're much more comfortable with those tests. So that just talks about how sensitive and specific the test is. A lot of the tests that are sort of the finger stick tests are less sensitive and specific than the hospital-based test. The second piece, though, is a positive antibody test really doesn't tell you if you're immune to COVID or not. Different people have different immunologic reactions, and so some will generate more antibodies than others. We're still learning more and more about how protective it is once you're exposed. And so really the main value for antibody testing is mostly for public health, and that is it can tell us what the prevalence is, so it's called a prevalence study, what the prevalence is or the number of people in the population that have been exposed to the virus. And so that gives us a good idea on how much of the virus was spreading out in the community that we didn't know about.
Some states, such as Virginia, have started to include a total number of antibody tests performed as part of their state daily count of tests performed. Do you think that's a good idea, and what could that tell the public?
It depends on how you bucket it, because they're used for two different purposes. So the PCR test, or the test that most people are familiar with, that's used to diagnose people or say you have an active infection. And so when we look at the number of cases going up, that's the number that you look at. The antibody-based testing can only be used to say if you've been exposed in the past from COVID. Now, there are some tests where you can diagnose acute infection, but they're not as reliable as the PCR-based test. And so really, there's sort of two different things that you're talking about. Now, whether you want to combine them into a single bucket to talk about testing, I think it depends on what your definition of testing is, but they're used for two different purposes.
Some people have expressed discomfort in the lifting of public health or stay-at-home orders because they believe that testing is not yet widely available, including for asymptomatic people or people who don't present symptoms more frequently associated with COVID. Is testing for asymptomatic people widely available? And if not, what would you say to people who wish to get tested before they go back to work or re-enter public settings?
So I've heard this question before from a couple of other people about testing to go back to work. And so the simple answer is there's not enough tests to go around to do something like that. But the other answer is the PCR-based test, so that's for acute infection, only shows if you have the virus at that moment in time. So it won't tell you if you're exposed to it and then become sick 3 days later. And so the value of it being used as a come back to work test is fairly limited. The other reason is there is still challenges in the supply chain for testing supplies, and so being able to expand testing to all asymptomatic people is just not feasible at this time. Now the testing supplies have been increasing over time. And so we are doing more and more testing on symptomatic individuals. If you remember early on, we were really only testing symptomatic people that were going to get admitted to the hospitals or healthcare workers. But we've since expanded that to really allow people that show up to our facilities with symptoms, even if they're not getting admitted, could still get tested. So it is expanding. We could always use more, but we're not at the point now where we can do asymptomatic individuals. Now, there is a caveat to that. We are doing testing on asymptomatic people in high-risk groups, and those are people such as in conjugate living facilities and nursing homes, places like that, where we can see really widespread really fast, and so you would want to know specifically in those populations whether there were asymptomatic carriers. And so it's a little bit nuanced.
Dr. Garza, we've also received several questions today about reports of a rare inflammatory syndrome impacting children. Are any area hospitals investigating cases of this inflammatory syndrome that is believed to be linked to the coronavirus?
So there's been numerous cases, especially coming out of New York, that have been linked to the coronavirus. Nobody is sure right now whether there's a causality between the two, but it does look significant. And so because of that, there's heightened awareness of this now at our pediatric facilities. And so in speaking with both Cardinal Glennon and St. Louis Children's Hospital, there have been at least one case with a COVID-related systemic inflammatory syndrome. So a word of caution about this. This is still a very rare outcome from an infection, even in normal times. So this type of inflammatory response, some people have linked it to Kawasaki's disease, things like that, can come from other illnesses as well. And it's still a rare occurrence. And so, but what it has done here locally is again learning from the experiences of other places has put in heightened awareness with our pediatricians and with our practitioners to be on the lookout for these sorts of syndromes.
What do parents need to know about this illness?
Really, it's just to be aware that, like you would if your child was sick with any other illness, running a fever, having abdominal pain, or breaking out a rash. Those are some of the more common signs and symptoms. And so, if your child is sick and experiencing some of these syndromes, to make sure you contact your pediatrician, or take them to get evaluated. Again, still a very rare occurrence, but do all those things that you would commonly do with a sick child.
And what are hospitals doing to care for these children?
Same things that they would normally do. So I think really now the difference is a heightened awareness for looking for this syndrome. Um, you know, this is still probably an underreported condition. Because people weren't used to looking for it before. But I think the biggest thing that people are doing differently is really just looking for it a little bit more intensely. As I said, these are patients that we've seen before in our facilities, and so we know how to treat them and how to take care of them and how to diagnose them. It's just now a heightened sense of awareness in the age of COVID.
It's been reported that some states have confirmed as many as half of their deaths coming from nursing homes. Are you able to provide any data for how many deaths or cases in our region have come from nursing homes?
I can't provide any data on the death counts, but what I can say is we do see a fairly significant number of our admissions and the patients that are in our ICUs that come from nursing homes, assisted living, other conjugate living, and so that sort of gets back to that testing question that I talked about earlier. These are very high-risk groups. They're living in close proximity to each other, are elderly, have some other diseases that make them susceptible to COVID. And so when we have looked at some of the numbers, we see anywhere from around 40% of our admissions are coming from some of these facilities. I've asked some of the other healthcare systems as well, and that tracks right along with what we were seeing at SSM at around 40%. It's somewhat dependent upon where the facilities are, whether they're close to some of these nursing homes, things like that, on what their volume is. But overall, it makes up a significant percentage of COVID patients.
Thank you. That concludes the list of questions received prior to and during today's live stream briefing. Tomorrow, the task force will release its update via press release, and the next live stream will take place Friday afternoon. Thank you.